Welcome, everybody, to the Blueberry Pediatric Podcast. I am here with three of our amazing pediatricians. They will all introduce themselves in a second, but the topic for today will be breastfeeding, breast milk, all things related, feeding children, feeding babies. All right, why don't we go around and introduce ourselves? Kristen, you want to start?
Sure. Hi, everybody. I'm Kristen Borchetta. I'm a general pediatrician in Florida.
Mia?
Hi, I'm Mia Armstrong. I'm also a general pediatrician and I'm based in North Carolina.
And Jess, our star here.
Hi, I'm Jessica Madden. I'm a pediatrician and a neonatologist also, and I'm based in the Cleveland, Ohio area.
But you're leaving out the most important part about your training and knowledge.
I'm also an IBCLC, so I'm a lactation consultant too.
What does that training mean? Like what experience do you have, just so everybody knows IBCLC?
Oh my goodness. So it just means that I've went through a process of becoming board certified and being able to have, oh my goodness, I think it was like 1,000 or 2,000 hours of hands-on experience helping breastfeeding moms and baby dyads. And then you also study. It's just like any other board exam. You study, you take a test, and then we recertify every 5 years, which I'm actually due to do later on this year.
That sounds
good. Yeah.
All right, great. So it's really special when a doctor also gets these extra credentials on top of the MD, because it's so specialized, and it helps our patients within the pediatric neonatal realm in an area that like everyone is experiencing, and there are not a lot of specialists to be able to help with. So Jess, I'm gonna let you lead and tell us we could start with like the most important things maybe for parents to know about all of this, or where to start once their baby's born, how to prepare.
Right. Oh yeah, absolutely. So I think a lot of breastfeeding talks start with what are the benefits of breast milk. I don't think we need to go through that right now, because I think that's something that's pretty much common knowledge at this point. One of the biggest things I was hoping that we could all chat about today is that what I see in my practice, and even in my Blueberry patients who I talk about breastfeeding with, they reach out when they need help, right? So there's a problem going on. So maybe their milk isn't coming in, they're having pain with breastfeeding, latching on it hasn't gone as expected. They're reaching out for help. That's fantastic. They should be. But they're often going into this whole area of having a baby and breastfeeding. I find, and I was also in these shoes, there is not enough preparation or knowledge attainment going into it in the beginning. So I was a breastfeeding mom 20 years ago, and I won't go through all of it. It didn't go very well at all with my oldest, who's turning 20. But what I've learned since then is the importance of, when you're pregnant and you're preparing for baby, to really, really prepare for breastfeeding. And that is not just buying and putting breastfeeding supplies on your registry. That is really getting in place who is going to be your team that's going to help you. See if you're going to have any risk factors for low breast milk, and chatting with people ahead of time. And another thing, and I would love to hear what you guys do too, I think one of the most absolute helpful things, which I never thought about 20 years ago, was you need to observe breastfeeding if possible. From a friend, a sister, an aunt, a cousin, somebody who you're comfortable with, because this is something that you're going into that you have never done before, and neither has your baby. I feel like that was a lot.
Well, it's very important to mention that as far as preparation goes, because I think a lot of people do think about all of the other things like the registry, as you mentioned.
Yep.
But you really have to look at what your support system is going to be and actually make that decision and start getting information early in pregnancy. I don't think it's a game time decision, because you want to have enough time to prepare. You mentioned observing breastfeeding so that you can get firsthand experience. But I think it's important to note that a lot of people in different cultures, they may have experience in breastfeeding, but then there's some communities that don't have as much support. So you really have to seek out that support. Definitely find a group of fellow moms or parents who are interested that can help you, because support is really the most important thing. I always tell my patients, though, breastfeeding may be one of the most natural things in the world, it is not the easiest thing. And so
Easiest.
you need as much
100%.
support as possible.
Yeah.
Yeah.
Yeah,
And I
that's a
think
great
also
point.
making sure your support system is kind of on board, because like you, I had a really hard time. Everything related to breastfeeding was a disaster for me. Like not one single thing went well. And the people around me were really unsupportive outside of my husband, but like they're like, why do you need to do that? Why bother? Just stop. And I get it. Like you want your baby to be
Yeah.
fed, but if it's important to you, it's so important to have that support around you to see if you can make it work.
Yes.
And there's still a lot of stigma in society too, and so a lot of people are, may choose not to do this because they don't have the support, or because it's not as commonly seen,
Yeah.
and that goes a long way when you're trying to make the best decision, and it adds stress on a new parent. You have all the other things to think about, and you want to do what's best, for your child. Everyone, you hear the term breast is best. I also would like to acknowledge that that's not something that's available to every family.
Yeah.
Everybody is different. And so I like to think fed is best. We all as pediatricians, people who love kids and want to see kids thrive, we want kids to be nourished, however that happens for your family. And it's okay to make the decision that works best for you, best for your family, best for your child, and for your circumstance too. And I always tell people, just to get the shame out of the room, I was formula fed, and I think I turned out pretty good. So, I think just having
right,
a caring parent. Okay, yes. But really just take that stigma away, because new parents, especially moms who are choosing to breastfeed, have so much shame around a lot of things. And so yes, there are benefits, and we'll continue to talk about those, but I also want to say you really have to choose what's best for your family.
Yeah. And sometimes it just doesn't work, right? Like, and you have to acknowledge that. Like, I held on for a lot longer than I should have, and my kid was like scrawny, and I wish that I had been able to accept sooner that like maybe it just doesn't work, and that's okay too. If that's what happens, like you just do your best for whatever you want.
Yeah, the stress that you bring up is a really a very important point, because you can't fully be a mother and present and enjoy all of it if you as a person are not whole, and there's too much, we talk about filling your own cup. I know it's like passe already, but if you're so empty and just trying desperately to make something work, but there's a really big imbalance in your mental health and your emotional stability if that is not going the way that is, if it's not optimal for the baby and you as a pair. So it's always a balance. You got to make sure that you can balance your emotional state and what's good for you as well as your baby in tandem.
Yes,
absolutely.
Yeah. Yes, absolutely. And I think that what you guys touched on too, one of the things I sometimes feel like a broken record, but to really emphasize is that when we're looking at breastfeeding an infant, this is not an all or nothing thing going on. Yeah. So there are plenty of situations where you may breastfeed your baby exclusively for a period of time and then start to supplement. You may do that from the get-go too. I usually say like any bit of breast milk is helpful. But again, like Lyndsey, you were saying, you don't want to go to these heroic measures and have it really interfere with your well-being in your enjoyment of being a new mom, because it's really hard just to be postpartum and be a new mom at baseline after these. It's like crazy. It's like running a marathon, but in recovery, but like 100 times worse. I only say this because I ran marathons in the past. And like, you feel like your body is just like shot, but having a baby is like this whole new hormonal milieu of all of these things too. I thought maybe one of the other things that astounded me that I did not know till after having babies and diving deeper into this, it's about 1 in 4 to 1 in 5 mother-baby dyads are going to be confronted with some sort of a major challenge with breastfeeding in those first couple of weeks of life. And I mean, I think we even see this on a pretty much day-to-day basis in our work as pediatricians. But I thought maybe we could talk about what some of those are. one of the most common things that I see is mothers dealing with just painful latching. So baby's latching on and there's like that sharp pain, or their nipples might get excoriated and bleed. Yeah, but there's many other ones. Do you guys have other ones that you see frequently?
Just getting a good latch to begin with and understanding what that
Yeah.
looks like.
Yeah.
Making sure that they're transferring and the baby's going to gain weight well. In the first 1 to 2 weeks, they're supposed to actually lose weight, but we want to make sure babies are not losing too much weight. And a rule of thumb is to go by is that they regain their birth weight by 2 weeks. Oh my God, what could I think of more? There's intolerances. There's what to do about knowing what poops should look like, how many times they should be peeing. Or
Undersupply, oversupply.
Let down being too rough.
Yes. Yes.
And I think finding
there's clogged ducts.
Yep. Yes. All
And
of those things.
And I think too, a lot of challenges that I hear is, especially when you do choose breastfeeding as your journey, and a lot of families, they think, oh, it's the breastfeeding parent's job to do the feeding, and people are really hands off. And so just kind of learning how to, if you have another parent or caregiver in the home, how they can still support you in your journey so that you don't feel all of the burden. I think, anyone who's raising the child, you feel like you have to nurture your child and feed your child and all those things. Of course you should, but when you feel like that's your sole responsibility, it can be exhausting because you barely have time, for yourself, because you are required to nurture and feed someone. But that work, and it is work, doesn't have to be on yourself. People can help in other ways. And then, once you do get experience with pumping, and I know we're going to talk about that as well, then other family members can take some of that, I don't want to say burden, the challenge away from you, so that you can, the mom can do what she needs to do and then allow someone else to feed the baby too. But all of that comes with learning, and it's not something that happens in the first few weeks or even months. You have to get a routine. So I think just show yourself grace and be patient with a learning curve. Every baby is different. Every breastfeeding time is different. So you have to learn what's specific for your child at that time.
Yeah. And going back toward the mom's mental health, it's really hard, I think, to let go of the idea of not knowing how much your baby is eating. And that's what everybody around you is asking. And the grandparents want to know, how much is the baby eating? I think that's something we could really do better during pregnancy to prepare the moms for that. It's okay that you can't track every little ounce, it's okay. That's a big adjustment mentally.
And there's other things that you can monitor too. So as pediatricians, we hear a lot about poops and wet diapers. And so there's other things that you can monitor. And I think it also is good to bring up having that relationship with your child's pediatrician and having that support too. So a lot of pediatric offices will have lactation consultants on staff. My former practice didn't. And so I got this CLC training, the lactation counselor training, so I could provide some additional support for those moms, because not everyone has that. But finding a pediatric office that will just, the pediatrician themselves will support you, will help weigh your baby if there are some concerns. And again, just making sure that you have that relationship. And even with your own OB, they may offer some support as well. So just maintain that relationship so that you can get all the community support that you can. It's important.
Yeah, definitely. I was just thinking about one of the big questions. This is especially first-time breastfeeding moms. They'll ask is, I feel like I'm feeding my baby and breastfeeding all of the time. Is this normal? To which I answer, in most cases, especially those first 2 weeks, yes. It is very common. You hear these numbers thrown out there, like a breastfed baby feeds every 2 to 4 hours. First of all, they don't feed on a schedule. Okay, they do not. It's on demand. And it can be those first week or two, it can be closer to like an hour and a half between breastfeeds. This is because you and your baby are both learning to breastfeed, and your milk supply is being established at this point from supply and demand. There's it's funny. I'm not going to say what the book was, but back when I was becoming a mom, there was a book out there that was super duper popular, all about how you're supposed to put a breastfed newborn on a strict feeding schedule to be able to get them to be able to sleep through the night by the time they're a month old. And I think that that's gone out of vogue. But what I am seeing is a lot of, so as like my age of people become grandmas, which is really crazy to think about. There's still, that book was popular when we were childbearing. So now they are starting to share that guidance. And so there's a lot of outdated information that's very well intentioned out there that I really want to get across. Does it feel like you're nursing all the time? Yes, because you are. And this is physiologic and this is normal. And this has to happen to be able to get your milk supply up. I don't know if you guys have.
You gotta remind yourself like there's light at the end of the tunnel, right? So
yeah, it's tough though when you're so sleep deprived. Like 100%. It's just like I remember like feeling like getting like 4 hours of sleep for the first time, and it felt like it was medicine to me. I was like, this is amazing. Like, I can't believe I just slept for 4 hours because it's so rough. Have you guys noticed that? Like, do you get asked that too about the frequency or putting newborns on a schedule?
Yeah. You see sometimes their parents are like, well, I want to get them on a schedule. So I have been not feeding for 4 hours. And, I think it's really important for us to stress that that's something that comes with time as the baby gets older and not something that we can try to force them into, especially breastfed babies when they're first born.
Early on. Right.
Yeah. And I think, and it's good that you did stress that point too, because mom may think something's wrong with my milk. My milk isn't satisfying my baby.
Yes.
But it's made to be digested faster than formula does. So you could feed a baby formula and then it takes slower to digest. And so therefore they won't feed as much. So again, that's where that network comes in, so that you're comparing, not really comparing, I don't like that term, but you're using someone's experience that is similar to yours that also breastfed their children too, so that you can get you won't have false expectations based on those differences in their feeding patterns. So
yeah. And the other thing too that I felt like, and maybe my experience just looking at this more from a pediatric and newborn medicine angle and not having that lactation lens, I admit I was not aware for a while of the importance of frequent skin to skin contact, mom on baby's chest, also during those first couple of weeks of life. So even when I've worked with moms, like literally who just had newborns in the hospital, I really encourage them, even if they're not feeding, instead of like, changing baby's diaper, putting their sleeper back on, bundling them up like a baby burrito, holding them, you know what, you can just kind of leave your baby safely on your chest. This is going to help your hormones to come in that are going to help to make milk. And that's another pitfall I've seen frequently. Families and friends, they want to come to the hospital, they want to come to your house and see your new baby and meet your baby. But the problem is that really can be disruptive to that first week or two of trying to establish breastfeeding. A lot of people are not comfortable with their breast open with a baby hanging out there and just having like their dad or their father-in-law, you know what I mean, in the room. And so I think if I could go back and change time, I would absolutely not have had my mother, my father-in-law, my best friend, her husband, all come in with us those first, week that we were home. I would have not.
I don't know why we do that. Like, it's so, right? It's like wild. Now I look back, and actually I had a baby around COVID time when like no one was allowed, and it was the way it's probably meant to be. Like, it's a personal, intimate time. I tell parents, I think I cheat with them and I say like, tell them I said it's not allowed, like as a doctor.
Right?
I'm not allowing anyone in, and they're like, oh, I have an excuse because I could tell my big nosy family that it's just not allowed and it's not my fault.
Yeah.
Right?
Yeah.
Lyndsey, the breastfeeding rates during COVID during that time were higher. And there's actually statistics and research showing that the number of moms and babies with breastfeeding challenges were lower. And I always thought that it was precisely that reason. Those first couple of weeks, you don't have those interruptions.
Yeah.
And you can focus on the skin to skin. and the sleep, and it's you, and hopefully you have a partner with you to be able to help
Like
you out.
breast
So
out.
Not having
exactly,
to
which is
entertain people, you know?
that, yes,
Yeah.
right, exactly. So I don't know if eventually there'll be some sort of a cultural shift or not, but that's just something that I really, really try to emphasize physiologically, especially if you're looking at breastfeeding, just setting yourself up for success to try to arrange life so that your baby is skin to skin on your chest a lot those first few weeks. And like dads can do skin to skin too. Other family members, your partner, they can do it too to give you a break. And there's nothing wrong with that too. Yeah. So the other thing when we talk about preparing for breastfeeding your baby is also to prepare to pump. And I think, Mia, you were bringing up something recently about insurance coverage of pumps. Is that right?
Yeah, so ideally it would be great. We talked about having that time where you can have the one-on-one skin to skin with your baby. You can spend those first few weeks to months of life getting to know them and allowing them to get to know you. But at some point, especially for a lot of working families, breastfeeding moms have to go back to work. And so I think pumping is something that's important because that not only allows you to store your milk so that someone else can feed the baby, some other caregiver or daycare provider or somebody or another parent. And then it allows you also, the ability to go to work. So I think that's another thing where research is important. You don't want to wait until the last minute to make a decision. Every pump is different. A lot of people don't know that some of their health insurances can pay for pumps because they can be expensive. I mean, they're just like any other technical device. So I think it's important to just find out what the benefits are if you have health insurance through your employer. So that's one thing that a lot of people don't know. And then, of course, doing research, talking with others about their experiences to choose the right thing. Again, everybody's different. Everybody's technical savvy is different too. Some of them can be really complicated or really advanced, I should say. So I think, again, doing the research is important.
Yeah. And even if you want to do mostly contact feeding or you're going to be a stay-at-home mom and you're interested in that, I mean, like you said, the pump can help other people feed. So maybe you can get a little bit of sleep. And then some breastfeeding problems, pumping may be indicated to help to increase your supply. So like, I think everybody should have a pump, regardless of how often you're going to use it,
No, absolutely. And I think it's also important to think about, if you know for sure, like you're going back to the workplace or you're going to be a student and have these periods of time away from your baby, you do really need to think about what type of pump you need. Okay. And I have some thoughts on this. It is overwhelming. When we had babies, there were like 5 types of pumps. Like, I feel like that was it. Now there's like 50 of them. Okay. The reality is, if you're going to be going back, say to like a typical 8 to 5 job, you're going to be in a situation of having to pump, 3 times or so during the day. I still encourage you, especially if your insurance will cover it, you want a double electric pump that you plug in, because those create the greatest suction and power to keep your milk supply up. There are wearable options. I'm not at all saying not to do that. Many moms will have 2 pumps, like the wearable and the one. But if we're looking at, especially if you're in a situation where you've been struggling with supply, or maybe those first couple months before you go back from maternity leave, it hasn't been the greatest experience for you, really try to invest in a pump. And the second thing, which I did not know, which I know now, is to make sure that your pump flanges are properly sized. Okay. There are 2 sizes that are standard that come in most kits. Like when you buy a pump, the flanges are the parts that you like put on your breast, so where the milk comes into. The standards are, they're 24 and 28 or 20 and 24. We now know that there's a huge range, and a lot of women actually require a smaller flange size, like an 18. Or there's other women that require a much larger one in the 30s. This is something that's not intuitive, but there are increasing tools on just pump manufacturers' websites. There's things where you can print out and like size yourself based on your nipple size. But that is a really important part of pumping. You need to make sure you not only have a pump, but the properly sized equipment to go with it. And I did not know this when I was pumping as a young mom. I had no idea. I just used whatever came in the kit.
Good point.
Yeah. Trying to think of what else on pumping. I usually, pumped milk, like storing pumped milk, right? Should we talk about that maybe a little bit
Yeah.
too? Or, okay. So in terms of storing your pumped milk, I typically will just recommend you can use either the milk storage bags that are made to store milk or glass containers. But when you're starting out pumping, I usually recommend doing it in like small, about 2 ounces or so in a bag at a time. And then making sure you always label and date so that you don't lose track of when the milk was pumped. You can store milk can be safely kept out at room temperature after you pump it for 4 to 6 hours or so. If we go beyond that point, we're really at risk of bacterial growth. I always would opt to just put it in a cooler bag right away or store it in a fridge. You can keep
milk that hasn't been drank yet. If you haven't,
not drank. This is just milk that came fresh from the breast. Yeah, fresh from the breast. Ideally, refrigeration, depending on what resource you use, is going to say somewhere between 3 to 7 days. I usually say it's about 72 to 96 hours, and it hasn't been used yet or fed yet. I'd stick it in the freezer.
What do you suggest for bottles that were used but not finished, and it's like precious breast milk left over?
Okay, so
The gray area, I know it's tricky. It's tricky if everyone's seeing Jess's torture right now.
So I believe I'm quoted on the internet somewhere as being interviewed once before. If your baby is not a preemie, does not have any sort of a problem with their immune system, I usually say you can refeed that bottle within 2 hours. So if baby has drank a little bit of it, there's some remaining, and it's been about 2 hours, you can go ahead and refeed it. I also sometimes do give the green light to put it back in the fridge and reuse it once. And the controversy around that is nobody's properly researched this. So there's theoretical risks of bacterial contamination. So that's where it's really tough to say. The only population is if they have a premature immune system or something. I wouldn't risk it in doing that. But it's really hard. I mean, it's so hard to pump. Like, this is precious, like, commodity.
I used to put in like 1 ounce at a time in the bottle because I had
Did you?
I was like, I am not wasting more. And so I would just be like, I'll burp the baby and fill the bottle up again. And it was a lot more work, but no, I mean, we didn't have enough.
But that way you're not wasting it. Yeah.
Right.
I
didn't have any to
I
spare.
don't know.
So, yeah.
Right.
And I think you all bring up a good point. It is work. And so we do appreciate moms so much and their families, their support teams for just, helping them in this endeavor. It is a lot of work though. So it definitely should be recognized. And we honor all of the moms that commit to this and just, parents in general that just commit to raising happy, healthy kids. One other thing I do want to say about medications and pumping, very few medications have to be avoided. Please make sure you talk with a trusted health professional to determine exactly what you should do with your milk if you are on certain medications, because most cases it's still fine to give that milk. You've worked hard for it, so we don't want to what's called pump and dump or trash it or anything if you don't have to. So just make sure that you get some trusted advice before doing that.
Yeah, that's a great time to ask your pediatrician or a lactation consultant about what can be used. Actually, especially with mental health medications, because you never want to just stop or cut down dosage on your own because you think that that's better for the baby. If you can't function and be present and healthy for your baby, then there's like risk benefit, like breastfeeding when you can't be a full present mother and enjoying your child, like then it loses its value, the breastfeeding.
Yeah, absolutely. And most medications, it's actually really surprising when you actually look at the data on how much passes into the milk. It's often really a small amount, like a really, really small, way smaller than you would think. I get asked about alcohol and breastfeeding a ton. Okay. And so typically the last time I did a more deep dive into this, if you're breastfeeding, it's typically okay to do like a glass of wine, a beer. I don't drink hard liquor, but whatever a standard size
A
shot
shot.
would be. Yeah. So like a normal serving, 4 ounces of wine, 8 ounces of beer, whatever that shot is an alcoholic beverage.
Okay.
So typically it's usually pretty well metabolized by your body within about 2 hours or so. So I usually recommend waiting at least 2 hours after having your glass of wine to either breastfeed or pump. If you do feel like you are getting drunk or tipsy, that's a sign that you probably should postpone if you can, okay, for a little while. Okay, so with alcoholic beverages, it's really important just to be mindful of not drinking, over drinking, how much you are drinking, like a standard size, like we talked about, and then making sure that you do your best to just space out nursing or pumping from about at least 2 hours or so.
The risk is not the breast milk alone. It's like you got to hold the baby and not drop it.
Exactly.
You're
It
drunk.
can't be over sedated. Exactly. Right. And so, but that was really similar to questions about medications. I just get the alcohol question frequently.
Absolutely.
Yeah.
But like, there's no. I've had friends who have said, I stopped drinking because, or like socially, not crazy drinking.
Yeah.
Like I stopped drinking because I'm breastfeeding, and like it almost pains my heart of like, enjoy your life, have a drink, it's okay, just be responsible, be mindful, know the parameters,
Yes.
don't go wild.
Exactly.
Yeah.
Right. Exactly. Yeah. And then another question that I get asked a lot about pumping is how soon do I have to start to pump? Like, when should I start to pump? Okay. And this is a question, there's no right answer. Okay. So what I'm going to say with pumping is, if you know you're going to, and again, like this standard, I'm returning after maternity leave to work and I'm going to be pumping, it's not a good idea to start pumping that very first day and not have done it prior to that. So usually, I usually recommend a couple weeks before you're going to have separation from your baby to start to use your pump at that point. It goes very, very well if you have not introduced a bottle to your baby yet, that it is not you that tries to feed the bottle of pumped milk to your baby for the first time. And that typically is because your baby is going to associate you with breastfeeding. So if they're snuggled up against you, they smell the milk, and then all of a sudden you're sticking this plastic, they're usually going to protest because they're really smart. Babies are so smart. And so typically I even usually tell moms, like, not only have another person feed the bottle, but if possible, don't even be in the room at that time so that they don't hear you, smell you, sense you. And it usually goes a lot better when you do it that way.
Yeah. All right. Last
point.
topic, which I think is a big one, is nipple confusion. Is it a real thing? How does it happen? How do you prevent it?
So I really don't believe in it. It's been out there. It's been out there 20 years now. This whole that you shouldn't use a pacifier because it's going to confuse your baby. The more research that's actually been done in it, the more this has been debunked. So this is old-fashioned nipple confusion. Are there certain subset of babies that maybe have yes, there might be like a small little subset overall, but for the vast majority of babies, they should be able to go between breast, pacifier, breast, bottle, and so on and so forth. I don't know if you got what your thoughts are on that, but I don't believe in it anymore.
Yeah, I agree with that. I think that once the baby learns, like we already know babies are very, very smart, but it takes training, it takes practice. And once you learn where your source of nutrition comes from, whether it's going to come, obviously you may prefer having direct contact with mom and having her nipple, but once you realize that it's not there and it's coming from this bottle, babies I think will eventually learn to take from whatever type of nipple is available to them. Now, of course, there's all different types of nipples. That starts a whole other conversation, a topic for another day.
Yes.
But I honestly just think you still just have to have patience, allow time for the baby to learn. Jess, you brought up a good point about not waiting until the day you go back to work, the day baby starts daycare, to make all of these changes. Again, you want to do research, you want to practice ahead of time so that it doesn't come as a surprise. But eventually, babies will learn, and they need to learn how to suck, to soothe, to pacify themselves, to be comforted by others who are available too. So I think they will eventually learn. So
yeah, I agree. I see babies all the time navigate through the 3 different, like, pacifier, breast, nipple of a bottle all the time. I think maybe they have a preference. I had an issue bottle feeding my baby when I was trying to get her used to that so I could go back to work, but it wasn't like a confusion. Like, she knew she didn't like it, and it was the bottle she didn't like. She wanted the mommy's breast, and she got it over time. It was just persistence, patience, and trialing over and over in the right situations, like with the advice you just gave. Let someone else do it. I had to be, like, in a certain position. I remember I had True, the TV show. I must go against screens for babies, but I was like, I'll do anything. Just take the bottle. And I would put True on in this weird ass position. And then finally she learned, and it was fine. And, like, she could still go back to the breast. But there's a good point to bring up within this, is that if breastfeeding is not working in the beginning, it doesn't mean it's the end of it forever. You can always try again, use bottles to make sure that babies are getting enough of what they need in the beginning, and then try again when maybe they've grown a little, matured, and introduce the breast at that point. So just hope right off the bat and say, I tried, I'm done, if you still really want that to be part of your feeding plans.
Yeah, that's a really good point. And that's kind of where, my 3rd and 4th kids, breastfeeding went really well and smoothly. But what we ended up doing was a process of weaning, where I got to a point where we just did, like, a 1 breastfeed at night, and I was able to extend that out for a long period of time. I think we should do weaning during another podcast, though, because that's a big thing to talk about too.
This was wonderful. Thank you so much for being here. We lost Dr. Kristen Borchetta in the middle. She had to drop off, but I really appreciate your expertise and knowledge here. I'm sure this will benefit a lot of new moms, breastfeeding moms, bottle feeding moms, formula feeding moms, all of the above. Okay. If you enjoyed this podcast, please be sure to subscribe and like. Thank you for joining us.
Okay, thank you.
Thank you all.
Okay, bye.
Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.